Hello, good morning everyone. Thank you so much for joining us. My name's Emma Kain. I'm a specialty registrar working with the South West Public Health England Health and Wellbeing team. So really warm welcome to everyone this morning. Thanks so much all for taking time out of your diary to dial in. This morning we're going to be hearing from people among the Southwest. So really great to have colleagues from across the Southwest, but also from other regions dialing in today. So today the purpose really is just to give us all a bit of time just to pause and think about how we're supporting smokers in our local areas at this time, which is, probably a particularly anxious time for smokers. And we're going to hear examples from colleagues across the Southwest about how they have used the Quit for COVID message to support people who are seeking help to quit or even just cut down at this time. So thanks to all of you who filled out the questionnaire as part of the registration process. I know that from this that lots of you have already been using the campaign materials, which is really great to hear, but hopefully today we can hear a bit more about how others have taken these and made them their own so that we can, pause and think about our progress on this. So in terms of what's coming up, we've got an excellent lineup of speakers, and we're going to hear a bit about how the campaign was born here in the Southwest, why it's important for us to really use this kind of unique opportunity that's presented to us now by COVID-19, why the communications are so important, what resources are available to us, a bit of an update on the latest evidence, and 3 case studies from the Southwest. So the last point that I'll just quickly make is I expect you've probably got lots of questions, so please do add those to the questions tab, which you should be able to see on your control panel. And similar to previous webinars which Ash have run, we're going to pose those to our speakers and send those around to you after the webinar. So thank you. I will hand over now to Dr Charlie Kenward, who is a GP in Bristol, and he is also clinical lead for research and improvement at Bristol, North Somerset and South Gloucestershire CCG, and also works with the NHSE and I Sustainable Improvement team. Thank you.
Thanks very much, Emma, and hello everyone. So I've just got a couple of minutes really to say how this kind of came about. And it all started in an appointment actually in my clinic back right at the start of the pandemic, well, quite near the start. And so I think we just set up our first isolation room and we were just starting to wear PPE for people with suspected COVID symptoms. And so I was consulting with a 9-year-old boy who came in with his mother. And the boy had a fairly minor illness, and his mum had mentioned that she was a carer. So, at this point, I was just interested in how she was feeling about the virus. And at that point, again, of course, we didn't know how badly it was going to affect care homes, but we were just kind of talking about her general concerns. And she mentioned that her biggest concern was that she was a smoker. So I just naturally said, well, have you thought about quitting? Because, that's probably the best thing you can do right now. And she looked down at her son. He kind of sweetly looked back up at her and sort of nodded, and she just agreed then and there she was going to quit. And so that made me think that actually the pandemic kind of gives us a moment where people are really captivated about health, and thought that this could be quite a good kind of lever and a moment for change for people. So I just came up with I don't know how I came up with it, but the hashtag Quit for COVID, and got in contact with Ash and said, what do you think? Do you think this message might have legs? And turns out it did. And Ash, in combination with our comms team at the CCG and our STP Healthier Together, have done a great job of kind of pushing the message out. So that's it really. That's where it all started.
Thanks, Charlie. That's great. I think that really kind of puts it all into context and really reminds us that this is a teachable moment for people, as you say. So thanks for that. And we're now going to move on to Hazel Cheeseman at Ash, who will tell us a bit more from their side about how this developed and a bit more background.
Thank you. Just wondering, somebody needs to share my screen. Excellent. Robbie, I can see that a few people in the questions are having problems with their sound. I don't know if that's something you can have a look at. Hopefully people can hear me. So I'm going to try and canter through what is quite a few slides. And thank you so much for having us on today, and to the Southwest for organising this event. And it's so great to hear Charlie tell his story, you know, where it all started. I think this is probably the first time that we've actually managed to have a person-to-person conversation, Charlie. I think basically it's been by email and through this slightly crazy period. But I'm going to talk through the evidence base, you know, in terms of what we know right now around COVID and smoking. And I'm going to move on to talk about the importance of communications and some of the resources that we have available through the campaign. So hopefully my slides will move forward. There we go. So what do we know right now about COVID and smoking? I think, you know, it's not unreasonable to say that the evidence right now is uncertain and it's still evolving. And I hopefully that's not a surprise to anybody. You know, this is a novel virus. Our knowledge about it is growing daily. And understanding something like the relationship between smoking and COVID is complicated because data on smoking status is often not well captured in normal times, let alone in the circumstances of a pandemic. So there's a great deal of uncertainty, I think, around the evidence that we currently have. So we do have some fairly good evidence out there that smokers are more likely to be reporting and developing COVID-related symptoms. But there does seem to be a bit of a difference in terms of whether smokers test positive. And one of the hypotheses for this difference is that potentially because smokers may be more likely to have a cough, for example, they may be more likely to have a test when they don't have COVID, and therefore have a sort of lower hit rates on the testing. But as I say, the data that we have right now is just not fantastic, so it's really difficult to answer those questions. But we do have slightly better evidence around smokers once they're in hospital. And what we can see is that the smokers who've been hospitalised do seem to have worse outcomes, greater disease severity than those who don't smoke. So these are some of the things that we can say with confidence at the moment about smoking and COVID. One of the hypotheses out there that people might have heard is that nicotine could be acting as a protective factor for smokers. This is unproven, although it is being tested through some studies, particularly in France. And it will be interesting to see what that shows. But it certainly is not a reason for smokers to continue smoking. You know, while we do not know everything that we might know about smoking and COVID, we certainly know a great deal about the long-term and short-term risks of smoking, and that it's better to quit. I think what the message should be to smokers is that it's always better to quit using alternative sources of nicotine as support, and perhaps, you know, the potential hypothesis that nicotine could be protective just provides an additional incentive to do that and to give that a go. So in terms of the evolving evidence, there is much more information on the Quit for COVID FAQs, and there's a link there, and we are updating that regularly, linked to the Living Review, which UCL are leading along with the Royal Veterinary College, which is excellent, and there's a link to the Living Review in those FAQs. But we do know other things about what is happening between COVID and in our communities. And this notion that we are all in this together is simply not true. There are definitely communities that are paying a higher price right now, both in terms of the impact of the disease itself, that we see higher rates of illness and death among those with who are experiencing disadvantage, and most likely because those people who experience disadvantage are more likely to have the existing conditions that put them at risk of COVID. But also the experience of lockdown is impacting disproportionately across the country. So, you know, people who are in low-paid jobs, on low incomes, are more likely to have lost their jobs and to see impacts on their income. And we also know that those people going as we went into lockdown, those people in the most disadvantaged areas already had the poorest health. And there's some evidence from the work that we've been doing that those unhealthy behaviours that drive that poorer health have been exacerbated as a result of lockdown. And that may be less true in relation to smoking and more true in other areas, but nonetheless, there are definitely groups of smokers who are really struggling right now. And of course, smokers are more likely to have existing health conditions, and the access to the NHS has been reduced in many cases, or people have been sort of frightened to go and seek the help where they need it. So the case for action is pretty strong, I think, to support smokers right now. There is always an immediate and urgent need for smokers to quit because it will improve their health and well-being almost straight away. And there is this additional opportunity to reduce the risk of COVID-19 exacerbation. And those enduring risks around, the loss of, healthy life, as well as the additional comorbidities that come with smoking, the fact that you live with poor health for longer than non-smokers, but also the impact on, for example, your likelihood of being employed and your disposable income. Really quitting smoking has got enormous benefits beyond the health benefits for smokers, which are extremely relevant as we approach economic uncertain times. So the case for action within both the NHS and local government and national government is pretty clear. We can reduce the burden of ill health right now, both in relation to smoking-related illness and COVID-19. We need to think about how we can build resilience up in the population, and looking at the burden of disease in relation to preventable causes, I think, needs to be a really important plank of that. There is going to be a lockdown health legacy, I think, and health inequalities really do look set to widen in quite an alarming way, and smoking can really be part of the solution there, given the social gradient on smoking rates. We can look at things like treatment outcomes. We know that there's a big issue building up around cancer diagnosis. Really, smokers coming into hospital, we need to make sure that they are being offered the support to quit straight away. We can potentially improve their survival chances if they do. And also, it needs to be a key plank of a future healthy economy. So just to kind of reflect on the opportunity that's there right now. So this is data from the YouGov COVID tracker, and we've been working with YouGov for some weeks now, capturing this information. And it's just, smokers are motivated right now to quit. So a quarter of smokers say they are more likely to quit. Around 20% of smokers are smoking less, and 2.5% of ex-smokers have quit completely. And I think it's very striking to me that there is a big age gradient here. So younger smokers are much more likely to be taking all of these actions than older smokers, which is generally speaking not true. So there is a tremendous opportunity here with the sort of 16 to 29-year-old population, but also again with populations of smokers that we often struggle with, people with mental health conditions quitting at much greater rates than the rest. But as I said before, there are groups in the population who are struggling. 1 in 10 smokers have tried to quit but failed during this COVID period. And some, about a quarter of smokers are smoking more, and 1 in 10 are smoking indoors more. And I'm also concerned that from the data, and this is not something we've published yet, that those with respiratory conditions don't appear to be any more likely to quit than other smokers. And you would really hope that would be different. So quickly to move on, because I'm sure I'm running out of time, the issue we're here to talk about, communications, it absolutely matters. So the ASH did a snap survey of local authorities, and we found the vast majority have got services back up and running. A tremendous effort from stop smoking services out there to get remote services running for people. But not every area is in reporting an increase in footfall. In fact, only around a quarter are, which given the higher motivation in the population might be concerning. And I think integrating the Quit for COVID messaging alongside some really proactive public communications seems to be the thing which is different for those areas which are seeing higher footfall into their stop smoking services. And some of the things that appear to be effective are things like paid for advertising, and that sounds really expensive, but things like Facebook advertising, are not expensive and are really cost effective. Really fabulous interventions like engaging health professionals via CCGs, and for example texting out to all smokers through GP practice, really effective measures to demonstrate the need to quit right now. Proactive media strategies, and I'm sure we'll talk more about that through the case studies, but also thinking about the smokers inside our organisations. Many of them on the front line really deserve support right now, and thinking about how we might reach some of our more vulnerable smokers through partner organisations. So communications activity, it's proven it's cost effective, and it really can drive up quit attempts both inside services and outside of services. So to talk a little bit more about the Quit for COVID campaign, it's been quite widely supported. I could have put lots of other great and good quotes up here, but I've left the ones up there from the LGA, PHE and the ADPH. On our website, you will find these FAQs, which hopefully provide you lots of information that I've not been able to talk about today and that you will find useful. We'll certainly circulate all these links already if you don't have them. There's also a communications toolkit that will be going out again this afternoon. It's been updated. We're on version 2 now. It's been updated in line with the evidence and changing environment. Strongly urge you to make good use of that. We've also been pushing out opportunities to do proactive media activity. We did, and will be, if you have been receiving things like Swiss cheese press releases from us, then get in touch and we'll make sure that you're on the list. There is the Smoke Free Action Coalition pages. I've got lots of other information around Quit for COVID. Let's go and have a look. There are past, there's the social media pack is on there, the things like the FAQs and so forth, and various social media assets and case studies. We've also got specific pages around smoking and pregnancy and smoking and mental health, where you can get more information there, and past webinars that we've run prior to this one. There is, what we want to see as well is local areas directing people to this Today is the Day page where smokers can get more information. And I have a plethora of I mean, I could have put so many up here, of people that have already done that. It's so fabulous to have this kind of rapid sort of shared action across the country, galvanized around this Quit for COVID message. And you know, I think we're well on the way to having a really strong, coherent campaign. We may well be getting some additional funding, Ash, in the near future to try and do some more proactive marketing. That will be quite targeted, but we would hope to make those assets widely available so that local authorities and others could also use them if they wanted to. And I'll stop there, and I'm sorry if I talk for too long, Emma.
No, that's perfect. Thank you so much, Hazel. Really helpful and great to see just how many resources there are available to us all. So yeah, we will be circulating more information about that just in case you haven't got those to hand. So we will move on now to Russ Moody, who is our Public Health England Tobacco Control Lead for the South West, just to give us a bit of an update from PHE. Thanks, Russ.
Thank you, Emma. Thank you, Hazel. Thank you, everyone. Really pleased to be part of this prestigious panel that we've got talking today. I'm not going to take up too much time. In fact, I've only got one slide, Robbie. If you could put that up, I'd be grateful. Which I'm just going to touch on. I don't think I'm going to be bringing any new news to the majority of the audience, but I think it is important in the narrative that we are talking today about Quit for COVID campaign and the engagement with it to establish PHE's position on smoking and COVID-19. So I won't go through this slide point by point. I will just point out that our position was published on the 29th of May. I have embedded a link into the slides, and I do believe that you as the audience will get the slides afterwards, so you'll be able to use that to take yourself straight to it. And as Hazel has reflected on, the evidence is mixed and developing, but it is improving. And of course, we will be led by the evidence, and we are watching developments very closely. And if the evidence takes us in a different direction, then we will change our position. Generally, for RTIs, respiratory tract infections, symptoms are more severe if you smoke. So it stands to reason that this could be the case for COVID-19, but we need to know more. What we do know for sure is that smoking is deadly. It leads to significant health issues, and that stopping leads to significant health benefits. We know the NHS is under a lot of pressure, and so it is entirely relevant to support smokers to quit. We currently don't know the effect of vaping and what that has on susceptibility. If there is a risk, then it's likely to be less than smoking. But again, it is something that we are looking at on a very regular basis and keeping in touch with. What we do know about vaping is that it's an effective aid to stopping smoking, and it's less harmful than smoking. And actually what we do want to avoid is relapse. I know that this is a genuine concern amongst my local tobacco control leads. of vapors going back to smoking for a number of reasons, and so that's something that we need to try and avoid if we can. Martin Dockrell, he's the Tobacco Control Lead for Public Health England. He also sort of pointed out to me some data and trends in the smoking toolkit study, and I don't have the data or the slides up here, but just to mention, the data, the trend does seem to be showing us that quit attempts are going up. So people are looking to make more quit attempts, but also the use of nicotine products is going down, and unassisted attempts are going up. And this has been a trend for a while. It's possibly exaggerated now with all the other factors that have been put in, have come our way because of coronavirus. And in the Southwest, I have been talking to my tobacco control leads. I've been going around trying to have one-to-ones with them. I'm aware that some of them might be online right now and haven't spoken to me, and I haven't got round to all of you yet, but I promise you that I will, just to kind of catch up and have a sense of what's going on for my tobacco control leads in the Southwest. But what's coming back from me is that services are adapting quickly. They are using digital technologies now, using telephone, a lot more flexible for service users. There are some challenges around access to pharmacotherapy and vapes, but they're managing that, and they're working very hard to keep services online. So when we reflect on all of that, and the other bit that jumped out at me from Hazel's presentation was the YouGov COVID tracker and people's appetite for quitting at the moment. It really comes down to this: it has never been more important to encourage smokers to quit smoking and to use nicotine in their quit attempts. And of course, as a huge champion of stop smoking services and smoking cessation, I would encourage that to be with behavioural support. It makes such a difference. And so I will just finish off, Emma, by saying that PHE fully support and back the Quit for COVID campaign, and I'm looking very forward to seeing how services and local authorities engage with it over the coming months. Thank you very much.
Thanks, Russ. That's great. I think, well, certainly from personal experience, I have heard a few voices just expressing concerns about the mixed evidence so far. So I think that really helps us to just hear that Public Health England is fully in support of this now. So thanks for that. We will now move on to our 3 case studies. So we've got Hannah, first of all, who is a specialist health improvement practitioner, part of the South Gloss Public Health team. So thank you very much for joining us.
Thank you. Good morning. Hi, thank you very much. I'm Hannah. I'm here from South Gloucestershire Council Public Health team to just give a quick overview of what we've done really in terms of the resources that have been made available for the #QuitForCovid campaign. Thank you very much for having me this morning. So a quick overview on when and why we decided to uplift the national campaign. We actually got started on the 18th of March. We put a post up just as everything was kicking off, and naturally we wanted something to be available for our smokers with the emerging, it wasn't quite evident at the time, but emerging concerns around respiratory conditions and smoking and how they link in with COVID-19. So on the 18th of March, we had our first social media activity, and within days of that, we started to hear more and more about this #QuitForCovid campaign launching and getting into motion. We jumped on that as soon as possible because the more resources we had, the better, and we did probably need a little bit of help. I'll talk about that in a minute. With our first post, that did get a lot of engagement and activity, but perhaps not necessarily for the reasons we'd want. So the next post we did, along with the support from Quit for COVID, was around the 20th of April. Started off just with our 1U service, our Healthy Lifestyle Service Facebook page. And then by the 4th of May, there was some space in the South Gloss Council Strategic Comms team to develop a real plan. And that involved the resources like the social media posts, the press releases, and we did some direct mailing to our residents and our partners via secure email. And since then and going forward, we've got some more activity plan, which I'll talk to you about in a moment. We didn't adapt for any specific groups. It was all targeted quite generally to our smokers. So backlash or concerns was another topic we were asked to talk about. So in terms of that first post we did have a few comments. oh, please, you can't put the blame on for corona on smoking enough without this. Time for such a campaign during such stressful times. I just can't believe the connection they're trying to make between corona and smoking. So many people are just losing the plot. I don't know if that was about us or about people in general, but possibly both. It's time you quit picking on smokers. It's our body, our choice, our money. And now this, smokers are getting picked on all the time. So we were asked specifically just to bring back some kickbacks we had on social media, and that was about as far as it went, and it was all focused on that first post. So the question is, what do we do about it? Well, our social media policy generally is to stay back, and unless there's a specific question or something that we need to get involved in, we tend to see how it plays out. And what happened was other members of the public started to answer back. So those comments, the negative comments, tended to be between the same two individuals who bonded over having a shared dislike of what we posted. And it came back with something like this. So someone wrote, blaming smokers, picking on smokers, what? It's a fact. Your lungs will find it harder to deal with the coronavirus should you get it. You will struggle for breath. Have you ever seen a smoker with pneumonia? It's scary, that's all I'm saying. So you smokers, get down off your high horses and accept advice or leave it. So I couldn't have put it better myself, really. What we did post back was just to say there was no mention of blame. It's just about giving support to the people who would like help to give up. Moving on from there and reflecting on what we've done so far, we were asked to talk about things that maybe didn't go quite so well. And one big concern that I had last month, unfortunately, South Gloucestershire services have disappeared from the National Smoke-Free website postcode lookup system. So at the start of the Today's the Day website, I believe that local services in the southwest were signposted individually. So there was a link directly to South Gloss services. But as that expanded, it went to the National Smoke-Free site. We had a bigger problem in that when people from South Gloss put their postcode in, it no longer shows up any South Gloss services. So that was a big hit. That definitely is not something that's gone very well, and we're still just getting that sorted out. But I've got some evidence around that, and it may be a good thing for other areas to see that did have quite a big effect on our website traffic. So we do know that that signposting route obviously was doing something when it was up and running at the start of the campaign in April. One of the more general concerns that we have, things that didn't go so well, was reflected with our South Gloss comms team, was that the prominence of this campaign was really difficult to get across amongst other really important public health messaging. So our strategic comms cover all the communications for the whole of the council, and public health were naturally having a big part to play, especially during those first few weeks around lockdown and beyond. So we felt like perhaps it didn't get the prominence that it really would have had at other times, but that's just part of how it is, and I've got some sort of further comments on that in a moment. In terms of what happened, data is very patchy, but this is sort of what we've got so far. So these are our web page analytics. So what we noticed that around the start of the campaign, we see sort of end of March time, early April, there was a big lift, which slowly tailed off again. And when we got involved a bit more around the end of April, there was another lift again. But unfortunately, we think around the 1st of May was when the website changed to that postcode picker that wasn't working for us. So that's when our website hits have flatlined somewhat, I'm afraid. So may that be good news to those who are working on the postcode pickers, that it did seem to have an effect whilst it was up and running, and we'll be getting that sorted hopefully as soon as possible. In terms of how that translated to access to services, again, the data is very early and it's very basic, but what I've been able to pick off is that registrations overall have seemed to climb, and we are seeing a sort of sustained increase in numbers accessing our services. Obviously, this service data is specific to our telephone service, which has been up and running for a little while, but as our face-to-face services in the community, the pharmacies and GPs have run less and less, and most places have stopped running face-to-face, stopped running services at all. So this just reflects our specialist service. So we are seeing a boost, and hopefully we'll see that continue and be able to look a bit deeper at those numbers as we go. So in summary, we've found the Quit for COVID resource toolkits really helpful, and they've helped us structure what we were doing and what we wanted to do in the first place, but they've given us a really consistent message, and the resources used have been brilliant to get those posts going and help us with the messaging around our residents. We do have some early data which seems to be promising, particularly our social media engagements and reach have been good in comparison to previous campaigns and other things that we're doing around the same time. Our advice for services would be to have plans ready So what we had to do was sort of wait for a gap in the public health traffic, so I called it, with comms. So when that gap was there and there was some space to put some messaging around the Quit for COVID, we had our full plan ready, and the comms team took that straight away and ran with it. So as soon as there was a space, we were able to plug those posts in and get them going. And that was really, really helpful, rather than wait for the gap and then decide what it was we wanted to do. In terms of next steps, we're pulling together some case studies now around the 4-week quit mark. We're hoping to get some real life quitters who've gone through our telephone services, particularly those who were concerned around COVID, and hoping to publish those as some good news stories. And we'd like to have a deeper look and analysis of our results of what we've got, and pull that in from different places, and keep checking that postcode lookup is fixed, and hopefully that will be really soon. I just say thank you to Lisa Jane from South Gloss Comms for putting a lot of this work together through our South Gloss channels. Thank you.
Terrific. Thanks so much for that, Hannah. That's really helpful to have that overview. I think that Hazel just wanted to come in just to mention something there.
Yeah, just on the National Smoke-Free website, it's been many of you will know it's been an ongoing problem. We've been talking just in the last few days with PHE nationally about it, and there will be a note coming out via centre leads, and we'll also circulate it via the SFAC about updating information there. If people have got situations like you found in South Gloucestershire, then please send us an email and let us know. We really need this information to be as good as it can be right now, and it's extremely disappointing that you've had the experience that you've had, and we are trying really hard to get it sorted. So please send us your examples, and we will do our best to get it right with PHE.
Thank you.
Great, thank you. Okay, so we will move on now to our second case study, which is from Bath and North East Somerset Community Health and Care Services. We have Julie Harrington on the line and possibly joined by Joe.
Yes, hello.
And we've got
thank you.
We've got both our Joes here this morning.
Oh, great.
The whole team effort. Morning, everybody.
Hello, hi. Yes, so we're from the Wellbeing Service in Bath and North East Somerset with Virgin Care. So we'd just like to start by setting the scene to tell you how we enabled continuity of our specialist service when COVID first sort of happened. So we aimed to avoid a break in service, so we switched very quickly to offering telephone support or digital support to our clients. We work in 3 localities, so we each contacted our current clients to inform them of how the support might change for them, to enable them to basically continue to receive support so that they wouldn't sort of lose out during the treatment. We're providing electronic prescription vouchers for NRT and Champix. We also obtained an emergency stock of NRT products just in case the prescription voucher system didn't work, and we've used that perhaps particularly for priority clients like our pregnant clients. And we also communicated promptly with our partners in primary care, secondary care and pharmacy to inform them how our service would be continuing to operate during COVID and how we were definitely still open for referrals and were able to continue to support smokers. So I'll just pass over to Julie for the next slide.
Morning, everybody. So what we did establish very soon after the pandemic broke that we needed to develop some community support within the area. Now that included the provision of food, medication and accessing people to over 2,000 volunteers in our area. The hub was established on Mothering Sunday, where we all got together with other multi-agencies, including Bath Mind, Citizens Advice and DHI, who are our drugs and alcohol project. We put together a hub, and anyone who calls the hub number for support or advice are triaged by an excellent team who ask certain questions. Very soon we established that we wanted one of the questions to be, are you a smoker? This meant that anybody phoning through to the hub, and we've now received well over 5,000 calls, would be asked if you were a smoker. In response to that question, we wanted the right advice to be given, and Joe, the member team, Joe Fuller, put together a training package. So anybody who took the triage calls into the hub were trained in given very brief advice to anybody who may be a smoker. We also trained people in Bathmind, Citizens Advice and DHI, so that any referrals that they received from people, they would ask the same question. And we actually received several referrals, many referrals actually, from people who sought access to other services, but through accessing those services, that it's been identified that they're a smoker. I think in particular, the work we've done with Citizens Advice has been very meaningful, because people at this time are often short of money, and we have received many referrals of people who would like to start smoking, not for health reasons, but for cost implications. We're very, very proud of the hub that we've established, very, very proud of what we've been able to do to support people in regards to food, medication, and also the fact that we managed to embed the smoking message in that community support.
Okay, so to engage and support smokers during COVID, we put in place some additional tools and offers, and that includes we created a new Stop Smoking Information Starter Pack, which we are sending out to all new smoking referrals, and that includes some PHE materials and some locally developed materials as well. A leaflet was created for us to add to all the local food parcels distributed by volunteers, which will be going to some of our target groups in which smoking prevalence was likely to be higher. So we'll be reaching more of those. Our colleague Millie created a lovely certificate, which you have a little image of, I think, to basically congratulate 4-week quitters. And this was a tool to help add some sort of praise and motivation to people at a time when they might not be able to have that face-to-face support and get that motivation that way. We also created a mini CO chart, which we included in the packs to aid our conversations about health benefits. This is obviously not really a replacement for CO testing, but we felt that in the meantime, in the interim, it might be a way of us actually a visual tool that we could talk to people about if we send them the chart, and we'd be able to advise on what their smoking level, their CO level would have been like when they were smoking, and what it might be like when they became a self-reported quit. We also started to offer e-cig or vape starter kits, which was a universal offer, but we've also targeted some other groups, which Julie will talk about on the next slide. And we're also able as an area now to offer the Smoke Free app, which is an NCSCT approved app, which I'm sure many of you are aware of, and that was an offer to new sign-ups, again to offer that extra motivation and support to smokers during COVID when face-to-face support is not available. Our health and pregnancy specialist advisors have also been doing a great job. They're continuing to offer the eBurn vape option along with NRT, and during COVID they've been offering that as a drop-off or postal service as well, to ensure that particularly those isolating or shielding or with small children were able to still access their treatment. And we also work closely, or we sit with our partner, the Wellbeing College, and that's not bricks and mortar, but it's local partners and organisations that provide an online offer, and that includes workshops and courses to enable people to improve their well-being. That has been face-to-face in the past. Presently, that is all online, and additional things have been offered to support people during COVID. And for smokers particularly, we're able to recommend this as perhaps a way of managing stress and forming new habits to help them when they're trying to quit.
So we were very much aware of the fact that we needed to extend our offer to certain target groups, especially those that we knew were vulnerable and at risk during this time. DHI, our drugs and alcohol service, and Reach, the local housing provider, very quickly managed to home everybody homeless in the Bath and North East Somerset area who wished to be homed, and provided them a really safe and secure accommodation. We wanted to extend our offer to those people, and so we offered them free e-cig kits. Now, this was provided via our drugs and alcohol service because we have trained them to be stop smoking advisors, and that's been a very successful initiative. We already had one service user who was known to the drugs and alcohol service who said, message at the bottom there, Scott, I think I've cracked it. I think it's become a bit of a tagline for us now, Scott. Thank you, I think I've cracked it. That's a real achievement for us. We've also been working really closely with Curo, who are our local social housing, mainly social housing provider, and at the moment we're looking into seeing if we can get a grant from them to provide e-cigarettes to all people in their properties who either have a existing health condition or live in a house of multiple occupation or live in a flat and can't get access to the outside. We would like to be able to provide an e-cigarette to everybody who lives in a Curo property, but I think unless we win the lottery or get a government grant, I don't think that's going to happen quite yet. But as they say, from little acorns, mighty oaks. So we're going to start with Curo and see how we get on. But the offer that we've given to DHI and to Curo has been very successful and well taken up. And we're really pleased by the way that's been perceived by people.
So some of the local comms during COVID. Our local tobacco control lead, Russ Sampson, probably known to some of you, produces a quarterly bulletin or newsletter called Smoking Matters. That goes out to all of our local partners in the tobacco control network and our level 2 advisors. And this is the latest edition, the COVID update that Russ kindly put together for us, including some of the links to promote Today is the Day and some other sort of topical comms as well about the ban on menthol as well. We also adapted some of the comms that have come through from Smoke Free. As you can see, there's all Quit for COVID, so we've adapted that and been able to disseminate it through our local area to promote our campaign. And I'll let Julie talk to you about social media now.
So we have a very successful and well-used Facebook page, which comes under the banner of our Wellbeing service. So it's not also the smoking service, it's also, we use it for our diabetes education, weight management and our child weight management programs. We've never been hugely successful with a Twitter feed. It's taken us quite a while to establish a Twitter feed, which this week we've just managed to do. So if you're not following us on Twitter, please try to do so because we're desperate for some followers. So please follow our Wellbeing service. The Facebook page has been well supported and we share the message with lots of local groups. So if we post a message to our Facebook page about Quit for COVID, we then share that with local groups, especially local groups that are based in our areas of inequalities, which for us would be Twerton and Snow Hill and other areas that we've identified. It's been well received. We did have a few negative messages, the very same as Hannah. I think one of the messages, you know, oh, here we go again, you're after the smokers, but the same as them, we let the public make their own decision on that, and it was quite surprising how many people replied to say exactly the same. You know, you need to think about others than yourself and think about your health, and we were pleased with how that went. We also shared the messages with the rest of our hub. As I said, Citizens Advice, Bath Mind and DHI have been, and 3SG, who are our volunteer coordinators, and it's been good to share the message with them and vice versa, us share their messages. So we've started to look towards the future, although it is very uncertain and as it's changing on a daily basis. At the moment, we're looking at running some virtual clinics. The database that we are familiar with and use is System 1, and apparently through System 1 we can set up groups. We're hoping to see whether we can establish some virtual groups via System 1. We are interested to see how we can evidence smoking status, and I've taken some advice from Louise Roth, who sent me some really interesting information about rested heart rates. And we have ordered as a pilot the personal carbon monoxide monitors. Now they are expensive, they're about £50 each, and we were hoping that perhaps we could in some way share them after infection control, but we're not quite sure whether that's going to be a possibility. So we have just ordered 2 personal CO monitors that are attached to a smartphone, And we're going to find 2 clients who we can post those to and see whether they find that a useful tool. We've been very lucky that Virgin Care have actually been able to get very brief advice training package onto our mandatory training page. They are going to develop a page for us that is designed just for us, but in the meantime, at the moment, we're using the one that's on the NHS e-learning page. And we are looking to see how we can offer our online level 2 training. I'm hoping that later in the year we can maybe establish a small group to do that, but we're not sure. Ideally, we'd like to re-establish our drop-ins. I think it will be appointment only. I think we're going to have to look at PPE and just trying to think how we can work slightly differently to how we've done in the past.
Yeah, that sort of brings us to the end. Our contact details are there, so if anybody does want to contact, then please do. I think we might have run a little over, so apologies for that.
No problem, no problem. Thank you so much. There was a lot in there. There's obviously been a tremendous amount of work that's gone into that, and so many different avenues that you've been pursuing. So really helpful to share that. Thank you.
Thank you.
Nice to talk to you all.
Brilliant, thank you. And you put any questions, so just a reminder, please do add any questions to the chat bar there, which we can put to our speakers afterwards. We do still have plenty of time for our final speaker, who is Matt Fisher, who's joining us from Live Well Dorset. Thanks so much for being here, Matt, and I know he has also lots to talk about, so I'll hand over now. Thank you.
Thank you, Emma. Thank you all. To start with a bit of context, Live Well Dorset is part of Public Health Dorset, which operates across 2 unitaries, Dorset and BCP Council. And to date, we've supported 30,000 people in Dorset to lose weight, quit smoking, drink less or move more in the past 5 years. So in March, we started to mobilise our team to help smokers quit for COVID. Our typical smoking cessation offer would be to signpost people to stop smoking services from a pharmacy, as well as offering telephone behaviour change coaching. But of course, with pharmacy services under pressure and due to lockdown restrictions, we created an offer of support to send packs of NRT through the post. So we had 3 options for smokers to choose from. Telephone behaviour change coaching sessions. Those sessions combined with 8 to 10 weeks of NRT, gum and patches, or the NRT gums and patches plus a 4-week call and the option to call or email us at any time to receive support. We also encourage smokers to download the NHS smoke-free app, which we find is particularly helpful. So March was all about preparations, sourcing that NRT stock and training our team, and in April our communications campaign was launched. And we really wanted to seize on this opportunity or teachable moment to say to smokers, as has already been mentioned, now more than ever is a great time to quit. So using the stats, background and copy circulated in the Quit for COVID toolkit, we created our own landing page on the website. We used the assets in the toolkit and shared the Quit for COVID Twitter clinic. We localized the campaign concept and hashtag with our own branding and look, and that message of within 48 hours of quitting, you're in a much stronger place to face coronavirus seemed to resonate really well with people. We did a media release and a few news articles came about as a result of that, as well as a radio interview. And we became aware of a university student who'd moved back to Dorset to be with his parents during lockdown and had managed to quit smoking by going cold turkey. And we used this story to humanise the campaign. And that message of don't smoke alone, quit together was the message that really resonated for Alex. And he quit along with 2 of his uni housemates. And more recently, after PHE's update around vaping, that we've been able to promote another story around e-cigs and someone who's switched to e-cigs for coronavirus. We've partnered with our NHS trusts and councils to spread the news through their networks and channels. So we shared graphics and copy and paste social media posts with these partners. And we have posted on many local Facebook groups, inviting people to take up the offer of support. And that gives you a sense of the organic activities that we've been working on. But we wanted to do much more than just sharing a few tweets and Facebook posts with our usual social media following. We wanted to reach and target a much wider audience who wouldn't typically see our media. And that meant investing in a paid-for ad campaign. So there are a number of different channels that we brought in for this. And firstly was Facebook advertising, the quickest, easiest and cheapest method to reach and target people. And this led to 86 trackable registrations. Others will have registered over the phone but aren't possible to track. And we tested 11 different Facebook adverts by altering the media and copy they used, trusting the algorithm to serve at the most engaging adverts. We found that a video of someone walking in a park with the text "breathe a little easier, quit for COVID" had the best response rate. The next channel was display advertising, and this came in two forms. Firstly, in adverts placed on our two largest local newspapers, and secondly, on national websites such as the Daily Mail, but shown only to browsers in Dorset. And the final channel was radio advertising. We're partway through a 3-month package of advertising on 3 radio stations, and radio listening hours has increased 25% during lockdown. 2 of the radio stations were able to tell us that they were able to reach 80,000 of people who are more likely to smoke in Dorset. And of course, these figures need to be taken with a bit of a pinch of salt, but they are based on consumer research that can be a helpful indicator. The Facebook and website display adverts both use the pixel on our website, which means that when someone clicks on the Facebook advert, there's a bit of code that will then show or retarget those adverts to that person on different websites. And we know that it takes multiple moments of contact before someone's ready to take that first step. So by reaching people on Facebook, on their radio, via local news articles and national website adverts, combined with organic promotions such as that post in their local Facebook group, we've been able to create a buzz and a multi-contact ad campaign. So just over £9,000 has been spent on this ad campaign and delivered 1.3 million impressions targeted at some of Dorset's 800,000 residents and retargeted using that website pixel. And the total registration figure here may seem small, but it's only including traceable registrations. The display, the Facebook ads, the radio adverts will have influenced many more decisions to come and register. It's just near impossible to measure or track them all the way through to registration. And of course, it's important to note that we're only partway through the campaign too. We found that it's a buyer's market right now. The cost of a pay-per-click on Facebook is quite low, and there's lots of opportunity to negotiate some good deals with the media outlets. So this is all about reaching people in Dorset who didn't yet know about Live Well Dorset, but we knew a portion of the 30,000 clients on our database were still smokers. So we ran a report to find out anyone who in the past 12 months had told us that they smoked, and this came back with 1,800 people. So we started to batch send text messages to these clients over a series of weeks. The final texts are just going out right now. And we didn't want to flood the service, so we've been sending them a batch of around 500 per week. And by the way, GovNotify is the tool we use for this, and I highly recommend it to anyone who isn't aware of it. It's a means by which to quickly and easily send thousands of text messages for free. All you need is a .gov email address, and the text messages, of course, have a near 100% open rate. So results, what's happened so far? Well, 574 people have registered with us so far this financial year. This is 50% down from the previous year due to these unusual times we're in. We'd usually be receiving many registrations to join our 12-week weight loss voucher scheme, but of course that's not possible as face-to-face groups aren't running. That said, the number of clients coming to us wanting to quit smoking has greatly increased, as has their impetus to quit. So 98% of these clients are ready to quit, whereas in the last financial year, that uptake averaged at around 75%. This indicates that the importance of quitting for COVID or the addition of free NRT packs has increased that desire to quit. 250 people are currently receiving smoking cessation support, and 50% of those people were non-smokers by week 4. Our coaching team has been nearing capacity, a good problem, so we've been monitoring that closely, and we've done things such as upskill other colleagues or delayed sending some of those text messages. In terms of take-up, the vast majority of people have gone for that option to receive that pack of NRT combined with either of the phone call options. So while quantity of registrations to the service hasn't been quite as great as previous years, the quality of registrations has been greater. 2 of our KPIs are registrations from males and people living in deprivation quintile 1, and both of these metrics have seen a good increase in the past 2 months, as has the portions of younger people joining the service. Again, a good indicator that the message has been targeted and resonating with the right people. More than 28,000 people have visited our website so far this financial year, and 11,000 of those people have looked at, there have been 11,000 page views of stop smoking pages on the website. Conveniently, just before coronavirus, we placed an article on our website titled "How long does it take to quit smoking?" And this is in what's known as position 0 in search engine results pages, and it's been driving a large quantity of traffic to the website, organic traffic. So that was really convenient timing. In terms of community support, there's been some great activity in our closed Facebook group, Our Live Well, a group of more than 2,500 people in Dorset who want to make a healthy lifestyle change. And you can just, for example, Debbie posted just yesterday, she's 6 weeks into not smoking and considered herself to be a non-smoker now. So there's been some record-breaking engagement in this group, and it's been a really helpful peer-to-peer support network. And we've been able to share quotes from people like this client to encourage other people to think about starting to quit smoking. As other people have shared, we've had some pushback from people, particularly on our Facebook adverts, and these kind of came in 2 categories. Firstly, that the stress and pressures of lockdown would make it a terrible time to quit, and secondly, many people responded saying that they've heard that the nicotine in smoking reduces your chance of catching coronavirus, and lots of references to the Paris study. And we wanted to gently and publicly correct this point of view. And you can see from our response here, using statements such as our public health experts, and this is one small and unverified study, seem to satisfy that debate. We felt that it was important to keep it friendly, yet debunk those news headlines, as it's another moment of contact in that person's journey to start stopping. Is there anything we do differently or more of? Yes, absolutely. We'd love to do more with more time and capacity to reach two target audiences in particular. So firstly, housing association residents, and secondly, carers through carer support networks. We've done a little bit of activity with these two audiences, but want to do more. In addition to this, we're currently exploring and working with our CCD about how we can send text messages via GP practices to their known smoking patients. Thanks for listening. I appreciate I rattled through a lot of information and data there at speed, but I'm very happy to take more questions and answer any queries you may have, and you can see where you can contact me here. Thank you, Emma, back to you.
Thanks very much, Matt. Yeah, as you said, loads to get through there, but some really helpful tips, particularly around the media and about responding to people's queries and concerns about quitting at this time, which I think is the trickier part of this, and really helpful to hear how all of the different areas have dealt with this. So, you know, thanks so much to all of you speakers who have volunteered to join us this morning and to share your experiences. I think that's given us lots of food for thought and just really helpful for others to kind of compare and contrast their approaches and think about next steps moving forwards. So I think, you know, just on that note, those who may have joined previous ASH webinars on the subject would have heard colleagues speaking about how the best ideas that they've seen have really come from the ground upwards, and how people have taken campaign materials and made them local to them and the smokers in their areas. So, you know, we're just really interested in that, and hearing about your innovative ways today has been great to hear. But really keen to hear from listeners on the line today about that. So we will be circulating some feedback, and as before, we'll be really grateful if you can help us out with that. And also just to hear from you if there's anything else that would be helpful in terms of resource or any other help from us in moving the campaign forwards. So the last thing I just wanted to also say, a big thank you to Ash for helping to facilitate the webinar today. It's been really fantastic working with you, and great to be able to share this with colleagues across the Southwest and more widely. So I think we will draw to a close now. Thanks again, everyone, and hope to hear from you soon.